What's up, YouTube? Today we're going to go over the potential of psychedelic drugs. This presentation was created by your own Tegan Burns. What exactly are psychedelics? So, the broad term of psychedelic can be categorized as an array of chemicals with varying structural compositions. Under this group include classic psychedelic drugs such as LSD and psilocybin. And the psilocybin is these magic mushrooms pictured in my slides right here. And so, for instance, many psychedelic drugs, including traditional hallucinogens, mainly stimulate serotonin receptors located within the central nervous system of your brain. So, these changes change the mood, your perception, and the consciousness that are accompanied by these psychedelic trips. And these result from the modulation of your serotonin levels within your central nervous system. So the main goal of these trips are the search for meaning and a higher consciousness, that is intricately associated with using such substances as psychedelic drugs. So now we can go over the types of psychedelic drugs, and I'll be using the word agents for the term word drugs in this presentation. So let's go over the first one, classic psychedelics. So these include like these psilocybin mushrooms, which grow in the wild, and other drugs like LSD, which occur within the world. And there's it's like it's an element or a compound of element. And then other drugs, and there's also other drugs, and they're famous for precipitating radical changes in perception, thinking, and feeling of oneness. And then the next main group I want to cover is empathogens. So empathogens are like known for they evoke a sense of empathy and sensitivity to emotions. So the best example of an empathogen psychedelic drug I can think of will be MDMA or ecstasy, and it stands out due to its therapeutic potential because it lifts the sense of empathy and sensitivity within someone's personal emotions. And then third, we have natural psychedelics. And this down here is called peyote. I have a picture. This is a natural growing psychedelic. It's also used for religious purposes as well within the southern United States and Mexico. And there's other like psilocybin mushrooms are natural psychedelics found in the world. And there's other more natural psychedelic, and when they usually come in plants as well. So and these go into they they're known for the change on one's mind. They change on the way they think and the way they do things, basically. So now we can go over the neuroscience of psychedelics. So I broke it up into four main points. So the first point I went over is serotonin receptor interaction when the drug goes into your system. Um, the main focus of these hallucinogens is the binding to the brain's serotonin receptors. Serotonin modulation involves a multitude of functions like altering one's mood, regulating physiological performance, and as well as affecting one's perception. Secondly, you have the 5-HT2A receptor activation. This also occurs with psychedelic ingestion within the body. So psychedelics like LSD and psilocybin are antagonists of the serotonin 5-HT2A receptor within the brain. And it is believed that this process triggers sensory perception as well as other cognition related changes, which are experienced as part of this experience. So, and then third, we'll go over the crosstalk between brain regions. So these psychedelic drugs induce better connectivity within brain areas previously not communicating. So these are like memories that you just don't remember or just buried back in your mind, or thoughts that you just wouldn't consciously have thought in the past. So it's kind of that uncovering of these dormant, you can say, receptors within the brain. And then fourth, we have temporal distortion and altered perception within the brain. So I want to go over this because it's a common effect of psychedelic drugs because it involves the distortion of our perception of time. So time can seem slower or faster when you're on psychedelic drugs. So this is caused by changes in the firing pattern of neurons, and the regulation of neurotransmitter release results in this modification in time perception during your trip. So the next topic I want to talk about is the therapeutic potential of psychedelic drugs. So I broke it into four factors again. First, we have psychedelic assisted therapy. So this is an expanding interest of using psychedelics as supplements to psychotherapy and also for psychiatric therapy as well. So patients are read through experiences by therapists to deal with core problems, improve self-consciousness, and nurture sociological recovery. And then the next one I want to go over is treatment of PTSD. Psychedelic agents such as MDMA show that they are quite effective in treating PTSD, as clinical studies indicate. Specifically, increased emotional understanding and decreased fear reaction are some positive outcomes. This is from a man named John Hopkins from the Hopkins Research Center. So, and then fourth or third, we have depression and anxiety. So, there are studies examining effectiveness of psychedelics in improving treatment of depression and anxiety and disorders. However, certain types of mushroom-based hallucinogens, such as psilocybin, have been found to trigger a more extreme and more prolonged reduction in depression as well. And then lastly, we have addiction recovery. So psychedelics have been proven that show like studies show that psilocybin may help people to take insight into themselves, motivate them to change, and decrease their urge for drugs in general. Next slide, I have personal growth and creativity. So I broke this up into four columns again too. So first we'll have enhanced creativity. So enhanced creativity goes with kind of the topic of divergent thinking, and it's connected with psychedelics as one of its characteristics. It is not uncommon for users to come up with innovative insights about some problem and be able to relate previously united ideas. Secondly, I want to go with the self-discovery and mind expansion within someone's self. So the psychedelic substances allow one to reflect deeply on oneself inside. So such personal growth comes with users gaining knowledge of the thought, behavioral pattern, and deeper rooted beliefs within oneself. The next topic I want to go over is expanded consciousness. So the psychedelic experience is often associated with an enlarged consciousness among users. The expanded state can provide better insight on the interdependence of everything, thus altering one's view towards reality. And then lastly, I have ego dissolution. So this is used for people that have a trip, they ingest a psychedelic, and they trip. So they have an ego dissolution is like a complete wipe of someone's like ego or their mannerisms kind of. So it's kind of looking over that, looking if you want to like get rid of it, you can get rid of it. If you want to build on it, you can build on it. It's something that is deep and in the soul kind of. So next thing I have is kind of some challenges and risk with this like, expansion of psychedelic drugs and this normality, like this pushing of it being normal within society. So first, I would say the risk of psychotic reactions. Psychotic relapses are prevalent for more those individuals who are like psychiatrically like susceptible and who also use psychedelics. So, and also those who have a family history of psychosis or schizophrenia might be more likely to experience these effects as well. And also, I want to go over psychedelics are not something you should be messing with. The right mindset and attitude and goal of the trip has to be set in your mind when consuming psychedelic drugs. And I would also say that there's potential for traumatic experiences. Some people might experience difficult or even traumatizing times in their psychedelic journey. The need is for adequate support and a controlled environment. This is so important, a controlled environment to reduce the occurrence of any harm. So now just looking ahead, so my call to action would be like just nurturing informed exploration. It is important that as we navigate this interesting terrain, we approach the possibility of a psychedelic agent in a responsible way, aware manner, and also ethically. To further unlock the positive aspects of these substances, we encourage the support for responsible research and I call for an additional scientific studies on the therapeutic use of psychedelics in order to enhance evidence based on mental health practices. and also call for education and harm reduction. Education on the hazards, advantages, and cautions use of psychedelics should be advocated for within schools to avoid damage and allow sound judgment of these drugs. Thank you guys. I'll catch you in the next video.